Your Excellency, Minister of Health, Honorable Permanent Secretary. First, I would like to thank you for the very warm welcome the team has received here in Finland and all the hospitality we met during this mission. It was really a pleasure to work together with our Finnish colleagues in this joint evaluation, and I'm sure we from both sides have learned a lot during this week together. Together, we have now completed a voluntary joint external evaluation in Finland. And I'm here as a lead. My name is Tegnell. I'm from the National Public Health Agency in Sweden. And I have my colleague here from WHO assisting me in leading this mission. As I said, I would really like to express my appreciation of all the efforts that have been made for this from the Finnish side in making this evaluation a success like it's been. And also for Finland, all the work you have done previously in establishing this process and all the work that's gone into that. And now not least that Finland as a country also have been one of the countries volunteering to do this exercise. I would now like to go through 3 of the main recommendations out of the more than 60 that we have been developing during this week. First, although Finland currently has a very high level of capacity and performance, we recognize that the country is also negotiating a series of reforms in the social and health sectors. And in order to maintain the optimum performance that's in place, health security and relevant agency and institutions must ensure that the plans and policies that now are developed and all regulations, legislations, etc., that will come out of this process will support the further application of international health regulation as a fully integrated part of One Health and a comprehensive security approach. Operations and functions in public, animal, environmental health has to be sustained and strengthened through adequate provisions of resources in each technical area, and a continuous investment in these areas will be necessary, especially during this reform. Secondly, we would like to highlight that Finland has achieved very high scores with either demonstrated or sustained capacity in almost all technical areas. But saying so, absence of real or possible events might make complacency come into play, and thereby giving as a result the cuts or redistribution of resources. And therefore it's imperative to continuously invest in HR to keep up this excellent performance that we can see is in place today. Thirdly, Finland has demonstrated a very high level of collaboration across the technical areas. There is a clear willingness among these multi-sectoral partners to come together and deliver. This should also, we think, be complemented where necessary by a clear chain of command and decision structures to allow for scaling up in times of major catastrophes and to address big incidents. So these were the 3 major recommendations we have out of this week. The rest of them will be published very soon. We have a lot of resources that we know are in place and that we think is very important for Finland to keep in place, especially in the area of this multi-sectoral approach, which I think is so important. And we really hope that Finland can keep on working in this One Health way. And we hope that this evaluation can help Finland to keep working in this multi-sectoral way, which we appreciated so much during this week. But now comes the maybe most important and most difficult part of any evaluation, and that's implementation. When you actually have to take these recommendations, develop them into a plan for the future, and see to it that the reforms and the new things that needs to be done actually comes into place. It is our hope that this assessment will make that easier for you, and that you will now be able to develop a plan both for the medium and for the long term. As a team, we would really like to note and express our appreciation of all the work that's gone into this process from our Finnish colleagues. Both this self-evaluation that you've done before we came and this joint week we have had together working on the further evaluation. We would also like to acknowledge and commend the team from the Ministry of Social Affairs and Health, who is coordinating and organizing this mission. And we appreciate the whole effort from the really big Finnish team we have met during this week, and how much they have supported us and made the finalization of this evaluation possible. Their professionalism, transparency and willingness among them has really made this effort so much easier and made it so much more easy and to find good solutions to the few problems we have encountered. Honourable Minister of Health, we have now concluded the country part of this evaluation. And as I said, we have developed a number of recommendations, and a draft final report is ready and will be published more or less directly after this meeting. We hope to have a final report ready very soon after that, which in draft will come to you for further deliberations, so that a final report can be available publicly very soon. So once again, thanks to the team from my side. It's been a pleasure working together with you. Thanks to my Finnish colleagues here. I met a few of you before, now I know even more from the Finnish side. And I'm sure they will form a good basis for further collaboration between Sweden and Finland in the future. Because one of the important parts of these missions is really forming this network of experts. That's going to be so useful in the future, I think. And finally, a great thanks to the Finnish government for all the efforts you put into this. Thank you.
Her Excellency Minister of Social Affairs and Health and Honorable Permanent Secretary, on behalf of World Health Organization, both from headquarters and the European Regional Office, we would like to comment on your excellent work for your self-evaluation and hosting the JEE mission. Our entire team is overwhelmed by your hospitality and the amount of work you have done for your preparation and during this mission. I would like to take this opportunity to thank Finland and appreciate their tireless support to WHO since the inception to rollout of JEEs. Since then, we have been working together to finalize the tool, standardize the process, mobilize the resources, and participating in several missions. When we work collectively, we can achieve a lot, and it has been already demonstrated as this is the 34th JEE, and as of today, almost 35 JEE missions have been completed. By conducting a JEE by Finland have already set an example that conducting a JEE is beneficial for all countries, irrespective of the development status, and can help to strengthen IHR capacity for health security. Since Finland announced it would be undergoing a JEE, we have had many requests from other countries, particularly in the WHO European region. It is important to highlight that JEEs are only a start of entire process, and it should be followed up with a development of a national action plan, and we are sure that Finland will develop the national plan based on these recommendations and will again set an example and motivates all countries that have done JEE to develop the country action plan. This experience of Finland can again support WHO and member states on this endeavor. With these few words, I would like to thank again the entire Finnish JEE team and external team members and their government and international organization for their support, and all of those who are working behind the curtain to make these missions successful. Thank you.
Ladies and gentlemen, first I would like to thank Dr. Anders Tegnell and the entire Joint External Evaluation team of international experts for your dedication and hard work for this week. I've been told that you have shown a great enthusiasm and eagerness to challenge our self-evaluation from the very first presentation. As Finland played a major role in establishing this external evaluation process, it has been very enlightening to be the object of the process in turn. The progress with the joint external evaluations under the leadership of WHO has been outstanding. Finland is already 35th country to undergo this evaluation and the first within the EU. The process has been conducted under the authority of the Security Committee. I wish to thank all the individuals and organizations who, with their hard work, made this process possible. Your extensive commitment and collaboration during the past 4 months has been exemplary. Very special thanks goes to the National Institute for Welfare and Health for organizing the process and hosting all technical sessions and site visits. We have done this, as always, together. The recommendations, as presented by Dr. Tegnell, will be carefully studied by the Security Committee and the national authorities, and also by the government. They will form the basis of a national action plan, which we hope to complete by the end of the year. As for now, I am pleased to inform you that some of the recommendations will be acted upon in the very near future. For example, AMR National Action Plan will be finalized before the World Health Assembly in May. This action plan has been drafted in true One Health format between the relevant organization and experts. Some other recommendations may take more time and effort, especially if they require budgetary resources or perhaps even more fundamental changes in the way we operate. The process for preparing the self-evaluation has required a wide scope of collaboration, coordination and communication between the different stakeholders. The authorities not only at the government level, but also from the municipalities, agencies, institutes and other organizations. Overall, over 300 people have been involved during the past 4 months. As such, the process itself has been proven useful already. The external process in turn has brought new perspectives and challenged us to justify our solutions. Who is in charge? Was asked often during the discussion I heard. The external team raised this and many other valid questions, but it's not coincidence that the team for our centennial celebration is together. Finland has been forefront of developing the health in all policies concept. We have implemented this concept in our work by creating many cross-sectoral collaboration models, including through our basic legislation. The ratification of the IHR and its implementation through other national legislation is a living example of this. IHR is not only about the health sector. Taking the whole of government and whole of society approach has been guiding light in creating the capabilities for health security in Finland. Also, integrating health security in the wider security concept, the comprehensive security approach is an important strength in Finland. The successful management of a crisis situation depends on the actions we take in normal conditions. Receiving reliable information and feedback on the strengths and weaknesses of our health security system is essential for its further development. This we need to bear in mind when drafting our National Action Plan. The National Action Plan will be an important element within the comprehensive security strategy for society. Moreover, the essence of this information and feedback is especially important for the ongoing process of social and healthcare reform. I promise we do our best to take all these important issues into account. Ladies and gentlemen, we are living in a world of ever-increasing interdependencies. The recent global epidemics have shown that the world is not well prepared in responding to these large-scale epidemics. Thus, building up capacity for health security is one of the targets under Goal 3 in the Agenda 2030. It is also supported by the commitments made through the Sendai framework of disaster risk reduction and biological and toxin weapons convention. Finland is committed to being part of this development. We have an incredible window of opportunity to effect change, to make the world safer and be better prepared for health threats. None of us can do this alone. We need all sectors involved and all countries involved in a coherent manner. By doing this together, we will stand a better chance in succeeding. As a member of the external team wrote in Twitter, our Finnish counterparts often argue Finland is a small country. Distance Helsinki, northern border, 1,800 kilometers, Amsterdam, Rome, 1,700 kilometers. Well, very true. We are a small country by population, but by size and by our actions, we are not. We need to take care of a very large area in a remote corner in northeastern Europe. Later in the discussion, the same expert commented that what Finland has reached within the 100 years of its independent history, it's remarkable. Listening to your remarks today, it seems fair to say that we have persevered. After all, it's hard to be humble when you are so good. Thank you again.
I don't have anything to add to those words. So I thank you all, the team here in Finland and also the external evaluation team, all the organizations. Teamwork is gold. The external evaluation week is closed.